Good afternoon and welcome to Embracing Senior Health. I'm your host, Candace Howell. This show is sponsored by Embrace Hospice, and each week we talk about very important health issues. And this week we've got some great folks with us, and we're talking about general health issues. And with me today I have Dr. Martin Duclos. Thank you for being with us. I have Patti Fink and also Charlen from Embrace Hospice. So, general health issues, when we start to talk about this with hospice, let's explain a little bit about what we mean with general health issues.
Well, basically, we look to take care of the patient across the continuum of health, from a well patient to patients with chronic illness throughout their course. When we become involved as a hospice, it's to deal with symptom management, to deal with the psychological effects of chronic illness, as well as to manage the patient's emotional distress and to involve the families in care of the patients across that continuum.
We talk a little bit too about homebound, and we want to explain what homebound means when we're in the hospice realm of the conversation.
We provide support to them in the home. We'd like to expand that to address a variety of chronic medical illnesses. To deliver service in the patient's home eases a lot of the burden on the patient, as well as the families, to transport them back and forth, and also to coordinate care, to assess safety issues, to address any social needs the patient might have at home, and to look at their overall health.
And Charlene, how does this really help out the family too? Because when you're dealing with a hospice situation, the family has a lot on them, and I know that's really hard emotionally. So to have someone that can help with some of these health issues, couriering back and forth, managing some of that medication, how does that help the families?
Well, it gives the family such a peace of mind. And they're getting the care from a physician to come to their home and do a visit. They're just so happy about that. Great medical care, good teamwork, and it saves the family. If you have a sick patient that can't get in and out easily, you're going to hire an ambulance. It's going to cost a lot of money. They're going to sit in a doctor's office for 2-3 hours, and that's not good for those patients. They want to have the most comfortable setting that they can be in, and they deserve it. So to have a physician go out to their home to oversee their medical care, not only is the best thing for the patient, but the family. Say a daughter has to work. She doesn't have to take the dad out of the work to go take her loved one to the doctors.
Yeah.
She can just go to work, and the doctor sees him, and the nurse, and we can just report back to her.
You're right. That could be a 4-hour chunk out of your day. And, Patti, the other thing too is I know all of us have our primary care physicians that we love and we have a relationship with, and that's really important to us. So to have someone coming in the home, what does that do for the patient too, to know that their doctor or their team is coming to them?
And one of the things that we've talked about with some of the other shows is that they can continue to see their primary care physician if they want to. But one of the things that we tell them when we go out is, we are the eyes and the ears for the doctor. We can report back to the doctor what's going on and give them a synopsis. And if there's something that they want to order or to change, then we'll just follow that doctor's orders in the home. And it's like Charlene and Dr. Duclos has been saying, it keeps them safe in the home, and it keeps them home without going out, because their energy level most of the time is so low that it's just a difficult task to get out to go see a doctor. And I think it's also reassuring to them to know that we've got our medical director right there close to the phone that we can call and say, we've got to have this order. Whether it's 3 o'clock in the afternoon, 3 o'clock in the morning, or holidays or weekends, we've got access to a medical director that can get what that patient needs for their comfort in the home.
And one of the things I want to talk to you about, Dr. Duclos, is medications. As we age, we end up on so many different medications. And those medications, we've all seen the commercials. It's scary. It could have this side effect and have this side effect. How does that start to affect us as we age and when we're in this hospice situation?
Well, in my experience, from the time when I was a primary care doctor 15 years ago to being a hospital doctor, I've seen one of the most important things that we deal with, and one of the most important problems that we face, is medications in patients with chronic illness, older patients, because there's not a good mechanism to assess and manage those medications, how well the patients are doing on them, are they having side effects, are they having interactions, are the medications working, and are they taking them? All the time we see patients who come to the hospital with a medication list that's 2 years old or has not been updated by their primary doctor, or when they come to the hospital, it's carried on from their last visit, or the patient will say, I was supposed to take this medicine, but I don't take it, I only take it some days. And really, the only way to know for sure what the patient's taking is by going to the home, doing pill counts, assessing how much medicine they're using, what medicines are being thrown away, getting replaced by new medicines. We see patients sometimes on 3 or 4 different medicines that do the same thing for the patient. The patient's not aware of what the medicines are for. They see different doctors. They may see for hypertension, they may see a kidney doctor and a heart doctor and a primary doctor, and they all have different medication lists and nothing's coordinated. So we try to coordinate that care for the patient in the home. We've had this over the years, an attempt to bring the care more into the home that's really failed because of time commitments on doctors. They don't have the time to go and see the patient in the home. Now, with the infrastructure we have with our hospice, we're trying to expand that to provide more care for patients in the home setting for them.
And you're watching Embracing Senior Health, so stay with us. We'll be right back.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey. Many people think that because you've been referred to a hospice services, that you cannot remain in your home and need to go to a facility. That is not true. Your end-of-life care can be provided by your hospice team in your home where you're most comfortable.
Welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by Embrace Hospice, and today we're talking about general health issues. I've got some great guests with me, Dr. Duclos and Patti and Charlen. Thanks again for being with us. We wanted to talk now about management of dementia. So we're in the home setting. Talk to us a little bit about how we can manage dementia.
Well, I like to think of the management of dementia in 2 separate stages, almost 2 distinct illnesses. The first is an early stage where patients might experience some memory loss, occasional confusion, trouble sleeping, and that is something that can be managed with medications, and the medications are effective at preventing or delaying progression of disease at times. Most of the time that's managed by a primary care doctor or neurologist or psychiatrist, and the focus is on prevention so it doesn't get worse. The second stage, or later dementia, is where patients start to have difficulty in managing their activities of daily living, which would be bathing, feeding themselves, dressing, ambulating, walking around their house. And those stages, our focus is on management of symptoms, treating agitation, treating pain, treating distress, and providing comfort to patients. In those stages, the medications don't work, are actually not indicated, and may even be harmful. So the focus is very different in those stages.
What are some of the things that we need to be looking for?
You know, you're going out with them and they're driving, they can't find where they park their car, or they might even not know where they live. Or you might find them not taking their medications. You might see in the refrigerator, you might have some old food, and those kinds of things is really the first signs, or they're not paying their bills.
Some definite out of character things for them as well. Symptom control versus hospitalization. When we're talking about chronic disease management, let's talk a little bit about that.
Well, ideally we'd be able to manage symptoms in the home, and that's often difficult to do for patients and families who have not a lot of resources to help them through that situation. They turn to maybe a home care agency that doesn't have the training to manage symptoms like that on a day-to-day basis, or they may rely on their primary care doctors or specialists who are not available 24 hours a day and who may not, it may take days or longer to get in to see the physician to where they can manage the symptoms. We provide that care at home, at the base, where it's most needed. Exactly.
And Patti, what does this mean to the patients and really the families too, again, to be able to have that level of care to them while they're home-based?
It is a security for them, knowing that someone's there to watch over them, to take care of them, to guide them, to be the eyes and ears again for them and for the doctor. So it's a good support, it's a good security. We can offer options with a lifeline system or private care in the home, other options that they may need. So it's a security for the family.
What are some of the differences that people really need to be aware of?
Different hospices have different levels of training, different capabilities, different resources to access. Hospice now has grown from a lot of different avenues to the same place. Often it'll be a home care agency that provides hospice services, or another primary care doctor will start to work with a hospice. Our hospice is designed just as a hospice. We are all board certified and qualified to provide hospice and palliative care, and that's our focus. That's all we do. For companies that have different requirements, different avenues, different sort of goals, they may not have all the skills to provide the services that we do in terms of symptom management and disease management.
Yeah, and a high level of care too. When we come back, we're going to be talking a little bit about Hospice House, so stay with us.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
Welcome back to Embracing Senior Health. I'm Candace Howell. We've been talking about general health issues today, and our wonderful panel of guests has been helping us with this discussion. I appreciate having you all as well. Before we left for break, we told folks at home that when we came back, we would talk to them about Hospice House. Let's explain what Hospice House is.
Well, Hospice House is a facility dedicated to care of hospice patients at the end stage of life. It's when the quality of life and comfort is the focus of treatment, both in management of symptoms and providing an environment where patients can remain comfortable, can remain in contact with family, as well as have skilled services available 24 hours a day to manage their symptoms.
How do you talk to the families? This is never an easy conversation to have with people.
Well, we all want to live as long as possible. We all want to have as much quality of life as possible and to stay healthy as long as possible. Unfortunately, often disease intervenes, whether it's dementia or chronic illness, heart disease or lung disease, and the burden of prolonging life becomes too difficult for a patient or for family. That can be from pain, from respiratory distress, from agitation, and then our focus changes towards management of those symptoms, providing comfort. And at that time, your goals change from trying to keep someone alive as long as possible no matter what, to providing a dignified and comfortable time of transitional period towards the end of life.
We mentioned before what hospice is a little bit in the beginning of the show, but let's clarify that, Charlene. What exactly is hospice, and or when are we at that point?
Well, I think a lot of people, when they say hospice, they talk about a facility. I'm going to send them to a facility, and it's not. And we've talked about this before. Hospice is the team approach to caring for somebody at the end of their life. It can be in their home, in a nursing home, assisted living, or in a hospice house if we need to bring them in for some really intense care to relieve some of those symptoms. So I think, and a lot of people are very afraid of what hospice means, because it means, that's it, I've given up. Well, it's not. Hospice is about what can we do to make whatever time you have left and add a little joy to your life and your family. You know, sometimes it may be journaling. It may be to do a video to leave to your great-grandchildren or your grandchildren. So that's what it's about. It's not about dying, it's about living.
Coming up after the break, we're going to discuss palliative care, but also what services hospice provides. We'll be right back. Stay with us.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by Embrace Hospice. General health issues is the name of the game on the show today, and we've covered some really great topics. Want to move now into palliative care and exactly what that means.
Well, we have noticed for several years in looking at data of hospice care that there were a lot of patients who had chronic disease that were going back and forth into hospitals and were at their doctor's office all the time, and were getting recurrent treatments and interventional procedures and tests and injections and strong medications with a lot of side effects, and they were doing very poorly. And so they were referred to hospice because folks thought, their doctors thought, the families thought they were at the end of what we could do for them in the medical profession. And we found that by providing hospice services, by focusing on symptom management, not necessarily putting them in the hospital every time they needed a medication, that patients not only lived longer, they had a much greater quality of life. Those I sometimes call graduates of hospice. They outlive their hospice eligibility, and they get better, and they do better by focusing on comfort and providing that care in the home. So that's what palliative care is really, is management of symptoms, and that goes along with hospice care sometimes, and sometimes it can be provided outside of the umbrella of hospice care. In Horry County now, we don't have a palliative care service anymore. We used to, but there isn't that ability anymore to provide that type of care in the home setting, and that's something we hope to provide in the future.
Well, and you touched on something with what you said too, and Charlen, I would like for you and Patti to speak to this a little bit. The difference between, for a patient, being in the hospital versus being in hospice. Quality of life and how a patient reacts to the care is much different, isn't it?
It sure is. I think one of the things is that the patient gets to the hospital, they lose control. They no longer have control of the family of what happens to them. Certainly they have input, but it's almost like you've lost control. And they're in a very uncertain environment. When they're in the home, they feel comfortable, their family's there, and that's where they want to be. They don't want to be in a hospital. So if we can bring palliative care team to manage symptoms, may not be on hospice, that's a great thing for the patient and the family.
And overall well-being too. I talk a little bit about that with palliative care down the road. I know that the overall well-being for the patient, that'll be better for them.
It will be, because it's in their home. It's like everybody said, it's their home environment. They can come and go more as they please. They don't have to be interrupted at 3 in the morning to get blood pressures or whatever. And having a doctor to oversee it can control some of those symptoms easier in the home. So it gives them some freedom and it gives them comfort.
And before we go to, I want to just remind folks about services with hospice. What are some of the services that you guys provide with Embrace?
Well, we work as a team, starting with our medical director, our physician. Nurses come to visit, home health aides to do personal care, volunteers, very important to give the family a little bit of respite, spiritual care, very important at the end of life, as well as social services.
And we, again, when can they contact you? I know at any point, but when should we really be looking at hospice care?
When they are at the point that they're not seeking any more aggressive treatment. You know, they said that this is the time that I just want to be comfortable, I want quality of life. You may be able to continue on that a little bit, but at the time that no more aggressive treatment is needed or wanted.
And for you guys, Dr. Duclos, the team approach, how is that important to the patient too?
Well, when you go to a doctor's office, you see the doctor, and you may see their nurse that takes your blood pressure, but they're not really involved in your care. With an interdisciplinary team approach like we have, all of those providers are an important part of the healthcare team that's taking care of you. And so it brings a number of different perspectives into the team management of patient's illness. The nursing care is different from what a physician provides, from what a social worker provides. And they can all come together to help the patients. And like Charlene was saying, the resources for home health aid is very important for having people to get groceries and to get medications and to have management of their medications, coordinate with their pharmacies. We bring all those factors involved in the patient. And it may be involving primary care doctors as well, who have a relationship with the patient to supplement the care that they provide as well.
On the medication side, just want to touch on that before we go too. I think for a lot of folks, having someone to help them manage that, not only to know that they're taking the right things, they don't have old medications like you mentioned before, the cost that you could potentially be saving them. And how you're able to do that is incredible, to be able to say, okay, well, you're past this side effect, you don't need this anymore, and how are you able to manage all of that?
It's trying to avoid duplication of services, duplication of medications, medication with interactions, medications that patients don't need and don't work. I've seen patients on the very end stage of their illness with advanced brain cancer, we know has a few days left to live, and they're still taking cholesterol-lowering medications.
Which isn't going to help them.
Which is not going to help and provides side effects as another medication to swallow. And it's just managing what the patient needs from the home base.
And this is what you guys as a team can bring from Embrace. You've been watching Embracing Senior Health. We have this show here on WMBF every Friday at noon. So join us again next week and have a great week, everyone.